Okay, so I'm here with Kaitlin Graye, owner of Evolve Medical, and we're going to highlight Kaitlin and her business today. So, thank you for being here.
Yes, thank you for having me.
So, a couple questions. Can you tell us a little bit about yourself and the business or organization that you work with?
So I'm Kaitlin Graye. I'm a family nurse practitioner and I own Evolve Medical. I founded Evolve Medical, we're going on 3 years this January, with the intention of increasing people's accessibility and affordability to quality obesity medicine care. I see a lot of weight loss clinics that have popped up on every corner, and we wanted to make sure that we delivered something different where we could really help people lose weight and keep it off.
What inspired you to get into this field?
So I was working at a really great weight loss clinic in an internal medicine practice, and they were so busy you couldn't get a new patient appointment with me for about 9 months. So it was time to grow, and I saw a niche and a need that was being unmet. So I decided to jump into practice for myself.
Have you ever been in business before?
No. I've helped someone else, a family member, grow a business, but I've never owned a business.
Very good. So what does a typical day look like for you?
So typically I get here a day or two, or an hour or two. Typically I get here an hour or two before I start seeing patients. I still have a full panel, so maybe I see 200 to 250 patients a month. So I'll arrive an hour or two early so I can kind of set up the other providers for the day, meet with my manager, focus on goals for the week, and make sure everybody else is set up to have a smooth day.
So you're the owner, but you also provide care and you have clients.
Absolutely.
That's a full day.
Yes.
So, and you've been doing this for how long?
I've been in obesity medicine for, this will be my 6th year, but I've been in my own practice for 3 years.
And it seems like you're thriving.
I'd say so. We've been really blessed. I think we've maintained our roots, and that's carried us really well through the community. So patients have referred friends, and word of mouth has really grown our business in this community.
Very good.
Yeah.
Very good. So, what do you love most about your profession and the work that your business does?
I love the lives that we change. Being able to empower clients to take control of their health and really partner with them, talk with them and not at them. So much of healthcare is broken in a lot of ways. Providers are sometimes really stressed and maybe limited on time that they can spend with a patient. The average amount of time that a primary care provider can spend with a patient in America is 7 minutes. So we do 1 hour initials with our patients. We pour a lot of education into them because we want to help them long term really understand how to manage their own health.
Yeah, I mean, without your health, you don't have anything, right?
No, nothing.
It doesn't matter how much money you have. If you can't walk to get the mail or go on a walk, on the beach or spend time with your family.
Oh yeah, and we're all working to retire, but you want to live well, not just longer.
Right.
So I love to be able to shape lives and see that ripple effect that happens in the community where we help a patient and they teach their children or they get their spouse on board, and then their coworkers ask, and it's really a great way to impact the whole community.
That's awesome. Yeah. What's a challenge in your industry or in running your business that most people don't see behind the scenes?
I think a lot of people don't realize how much weight stigma there is. So you go to the doctor's office and maybe instead of being heard, patients will report that everything is blamed on their weight. Some things that maybe aren't even weight related. Studies also show that people who interview with different companies, if they are over a certain BMI, they're less likely to get jobs. So I think really bringing attention to obesity as a chronic disease and being an advocate for treating obesity as a chronic disease is important to us for what we do here, because we want companies to recognize it's not just a choice. It's very complicated. There's a lot of metabolic factors that go into it. So each and every patient that we see, we really try to teach those things to, because they're able to spread that message to other people and maybe change some of that weight bias that's just innate and kind of taught to us in this culture.
Right. I mean, I have an 8-year-old and a 5-year-old, right? And so the food that they like is just, it makes all of us gain weight.
Oh yeah.
And we're just surrounded by it all the time.
Yeah.
And it almost seems like our society is trying to make us that way, which may be another conversation. But could you tell me a little bit, maybe somebody that you've worked with for a year or two who's seen results and what that was like?
Oh yeah, absolutely. I mean, we've seen thousands of patients at this point, which is great. I think obesity is complex, but definitely what we've seen in this country is that it kind of, the rise in obesity correlates with the rise in industrialism. So you've got two parents working, you've got kids in sports, everybody's busy. So as a result, we've kind of become a nation of convenience. So I like to take the blame off of a patient and kind of meet them where they are, because I'm not going to be able to create more time in your day sometimes, or really increase your access to all whole foods sometimes. We got to work with your lifestyle. I always tell patients the best diet is the one that you can stick to. Because if I create something that's not sustainable, I'm not really helping you in the long term. So I've had patients who've lost over 175 pounds, I think are my biggest losers, which
Biggest losers.
I know. Losers in a great way though. Right. And then I have patients who just want to lose 20 or 30 pounds because they want to get some of that weight off of their knees and their hips. Every 1 pound that you lose is 4 pounds of pressure off your knees. So I tell patients there's no goal too big or too small for us to help you with.
Wow. And different than a normal doctor, are there check-ins? So they come in for the initial meeting, and then there's probably more accountability to help with that, right?
Absolutely. So after the first 1 hour visit, we typically see them back in about a month. We want to make sure you're doing well. We want to make sure that we catch any potential side effects, or maybe just some challenges that you might have with understanding the diet. We also have a dedicated patient line, so patients are able to contact us in the portal, and typically we're going to get back with them the same day, which a lot of patients don't really believe that we're that responsive. But I think since we've kept our practice really patient-centered, it's not usually a challenge. Patients just want help, they want a simple answer, and they want somebody to support them. So I find that being really proactive and responding to patient care helps a lot on the back end. So when they come in for their 1 month follow-up, they don't have 15 problems. We're kind of able to just talk about what we need to talk about face to face, and we've maybe fixed their problems with their side effects or prescriptions the day that it started.
And I imagine when people start to make progress, they've got to feel so much better about themselves, not just physically, but mentally, emotionally, for their family, all of it.
Absolutely. We see a lot of correlation between obesity and depression. So sometimes we're referring out to some of the counselors in the area that we maybe know have some experience with weight sensitive topics. Sometimes we're referring to the dietitian that we work with because they might need a little more education on like the diabetes or the chronic kidney disease side. Sometimes we're educating them or managing some of their blood pressure or their cholesterol meds because we see them so often. But what I find is that overall they have such a better understanding of their health that they feel a lot more empowered going forward to lose that weight and keep it off, and maybe not have to see us monthly after a certain period of time, which is the goal. We want to help empower you so you feel like you can do this forever.
That's great.
Yeah.
So when you're not running a business or meeting with clients, what are you doing for fun?
So I have a giant schnauzer that I really love. I was never a dog person, so I got this giant schnauzer. And then I really like traveling. My significant other is on the Blue Angels team, so that's been a really cool experience over the last couple of years. Cool. And sometimes I just get to travel out to these different cities and see a show and maybe explore the city while we're out there.
Yeah. Giant schnauzer, they're the ones that have the loud kind of bark, right?
It's actually not a barker. They're the ones with they have like the little beard and usually the cropped ears and the cropped tail.
Right. Mm-hmm. They're usually black, right?
Yes, they're usually black.
Okay, what's something people might be surprised to learn about you or your business?
See what I said. I could just cut that piece out. Oh, yeah. Something that people might be surprised to learn about me is we service multiple states. I know a lot of my patients have said, can you see my cousin? Can you see my uncle? Can you see my friend? And usually what I'll tell them, I'll give them a list of states, and if they're really adamant that this person wants to commit to care, a lot of times one of us will just obtain a license in that state. So right now we see patients throughout the state of Florida, Alabama, Arkansas, Arizona, Virginia, Georgia, and working on California.
Wow, so I'm assuming that's remote.
Yep, we'll do telemedicine for patients who can't come in person. So we give either option because sometimes people really can't get away. We maintain normal clinic hours, and sometimes people can't get off from their job, or they can't get here from Louisiana or Georgia. So we want to make sure that we're finding ways to make care accessible.
Well, I think that's fantastic because, like we've said several times, I mean, without your health, what do you have?
Right.
And a lot of people, I'm sure, are self-conscious or sensitive or scared to go ask for help, and coming from a friend that might have used your services, that feel comfortable with it,
Yeah.
that referral probably helps them feel more comfortable.
Absolutely.
You know what I mean?
Yeah, it means
Yeah.
everything in the world to really get clients from patient referrals, because that means you're doing something right.
Right.
Yeah.
Absolutely. Okay. Who has been the biggest influence on your career mindset or your approach to running your business?
Absolutely, I'd say my patients. When I first jumped out of my job in internal medicine, where we took all insurance and I jumped in and opened my own practice, I wasn't sure if this was going to work or people were going to come with me or what was going to happen. And I'd say I went from a panel of 30 starting my own practice to 300 in 30 days.
30 days.
In 30 days, yeah, I was definitely not prepared. So many of my patients followed me. They really wanted to continue the care that I was giving them. They didn't want to find a new provider. That spoke volumes to me in those first 90 days. I had patients stop by and offer to help us put together furniture and paint walls, and just to see the support that my community gave me when I opened this let me know I was doing the right thing.
Awesome.
Yeah.
That's got to be a major affirmation.
Absolutely.
To see that support.
Yes, because you're never sure it's going to work when you start, right?
Yep.
Yeah.
Absolutely. I mean, the challenges of starting from almost nothing,
Right.
and then building it and having employees, it's a huge responsibility.
It is.
And then you want to take care of your clients and provide them with consistent service.
Yes.
Like you just said, I mean, I think the telehealth thing is where they can check in the helpline. That's an incredible resource.
Yeah.
For somebody who might be, struggling or just need advice.
Absolutely.
Right? Yeah, that's great. How does your business make an impact on people in the local community?
So recently this year, we started some employee wellness programs. Our very first program was with City of Pensacola. We started out approaching our police department, just saying, these are some of the things that we can offer the officers to try to get them healthier. They're the people who take care of us. We want to take care of them. And the chief of police, Chief Randall at the time, was so excited about it, he decided to offer it to all of City of Pensacola. So I think it was one of those moments as a small business that you're like, wait, is this happening?
Wow.
So that's been really great. We've done some lunch and learns at City Hall. Recently, we were in talks with the Escambia County Sheriff's Office, trying to offer them some of the same things. And this year, I plan to expand to other businesses in the area to offer them the opportunity to offer their employees these wellness programs. You get a lot of mid-sized businesses, I think, that don't realize that, one, when you offer some sort of wellness program, it's tax deductible. And maybe you're a business that can't quite afford health insurance for your employees, but maybe you can afford like $60 a month for them to enroll in some sort of weight and wellness program where we can give them labs, we can give them a 60-minute initial appointment. We can really take time to improve their health and wellness, and the return on investment of that is huge.
Right.
It's huge.
Yeah.
You see people with a BMI less than 30, they have about an absenteeism rate of 4 days per year. Those with BMI over 30 lose about 8 days of productivity a year. So
Wow.
big differences, especially when you're looking on large scale numbers. 4 days to 8 days doesn't seem like a lot, but it is a lot of loss of productivity. Right. So really trying to get companies to realize like that little bit of spending in the beginning is going to give you so much return on investment in the end and help with employee retention. Right. That's our next big goal, is to try to reach out to business owners and let them know what they can do to take care of their staff.
Absolutely.
Yeah.
Because in a lot of industries, you have to have 30 to 40 employees to be able to afford healthcare.
Absolutely.
And I mean that's a fair-sized company, and the majority of the rest of the small businesses are smaller than that.
Yeah.
And so helping bridge that gap for employee retention has got to be a very useful resource.
Yes.
That's awesome. Congratulations.
Thank
with
you.
The city. I mean, wow.
Yeah, that was really exciting. It was really exciting.
Was that a lot of work to put all that together?
I don't ever feel like it's work. I really love what I do, and that sounds so cliche, and I think people say that all the time. When you love what you do, it doesn't feel like work, but it doesn't. The opportunity to make an impact in the community where you live is huge. My big goal was to just bring attention to the city of Pensacola and say, hey, what are we doing to keep our community healthy? These are our numbers. These are state of Florida numbers, and we want to do whatever it takes to like move us up and make us healthier, so people aren't just living longer, they're living better, and that just results in a whole community of healthier individuals who are being more productive, companies that do better, people that are happier. There's a slew of benefits that happen whenever you take big steps like that. So I was really excited the city of Pensacola decided to give us a chance and serve our community.
Well, it's very obvious that you're extremely passionate about this.
Yeah.
And I mean, there's a massive amount of intrinsic value in what you do. You know, if somebody lost 175 pounds,
Oh, yeah.
that's life changing.
It is.
Right? Probably more than winning the lottery in a lot of ways.
Yeah.
Right? So that's awesome.
It is. It's a good feeling.
Yeah, I'm sure. All right. What advice would you give to someone starting out in your profession or launching a business in your field?
So I think you and I maybe worked with some of the same consultants, and one of the consultants I worked with, Kevin, has been
Kevin Tuttle.
Kevin Tuttle.
For those
yes.
watching. Yes.
For those watching, I hired him as a leadership coach maybe a year or so ago. And one of the first assignments he gave me was to work on my vision, mission, and values. And that's something that I have picked up and put down a number of times. And then when he really held me accountable, maybe finish them,
He'll do that.
he'll do that. But that's great though. We want people to keep us accountable and make us grow out of our comfort zone. So I think when I really clearly identified those, it was easier for me to hire. It was easier for me to let go of people that maybe weren't aligned with my goals. So I encourage any business owner to take a little time and write down your vision, mission, and values, and make sure your decisions and the people that you bring on your team are aligned with that.
I think that's really good advice.
Yeah.
And it's so challenging in the beginning when there's so much to do and your resources are so limited.
Absolutely.
And so in a lot of ways, for me, it felt like I was making decisions more out of necessity than having a clear endpoint.
Yeah.
And having that clarity of where I believe we can go, and some plan that seems to always be changing on how to get there makes those decisions a little easier.
Yeah.
Right. Yep. But I think it's great that you also had the willingness to work with a mentor. Like for me, Kevin has been huge.
Absolutely.
Right? You know, I think as business owners, we're often in positions of authority, right? We try to be in positions of leadership instead of just a manager, but we need people to hold us accountable and tell us what we need to work on, that are not afraid to tell us that, right? And so hiring professionals and outside help, especially on the caliber of Kevin Tuttle, once again,
Absolutely.
has been huge for us and for me.
It is.
Yeah.
It is.
So very good, very good. All right. What's one piece of wisdom you wish you could go back and share with yourself when you first started your career or business?
Okay. I feel like I wrote something down. Was that right?
It's a lot of questions.
When I first started my business. We'll talk a little bit more about mentors. So I'd say be as transparent as you can with mentors that you hire. I recently had a talk with one of my mentors at the Student Group, and I'm in the SCI program, Student Community Institute, and they pair you with mentors in the community who are C-suite executives and maybe presidents or CEOs of huge companies. And after talking with one of the other mentees, she gave me a good piece of advice. She said, tell people what you don't know and tell people what your struggles are. People can't help you if they don't know what's wrong. So I think sometimes, especially as a small company, we're trying to make it seem like we have it all together because we want to present as such. But if you're not being transparent with people who can help you, they don't know where your weak points are.
Right.
So inviting people into your life like Kevin Tuttle or some of my mentors at SCI, sometimes it's a really humbling experience. I'm sure you can relate, where you feel really vulnerable and raw to just identify some of your weak points. But I think that's the big difference between people who are leaders and bosses.
Right.
As a leader, we want to set an example. We want to continue to get better. We want to take care of our people. We want to run with the team, and we want to lead. So sometimes that requires that you bring people in that you need to be really vulnerable with.
Right.
Yeah. So do that early on.
I 100% agree with you, all the way from, you know, when you get a team of 5 or 10 or 20 people that are all looking to you for answers, you don't want to, it's uncomfortable to admit that maybe we don't have all the answers, right? But I think it hopefully shows some wisdom and willingness to bring in somebody to help, because how can we expect our teams to improve or do the next project or learn the next software or get better at sales or whatever it is if we're not also willing to do that?
Absolutely.
Right? But then being vulnerable, that's like a learned skill. You know, it's scary, it's uncomfortable, especially when you're just getting to know somebody. But like you said, if they don't know, they can't help.
Right.
And I think probably most of the people that a small business owner would bring in their team have probably been through it anyway. So it's just, the way I look at it is I just have to get out of my own way.
Right.
Like, to me, it might be a crisis and it might, whatever, but they're gonna help and forget about it, right?
Yeah.
Or check in with me later. So I think that's great. That's probably one of the reasons you've done so well so quickly, is that willingness, right?
I think so, and taking a lot of accountability as a business owner to just, like you said, tell your team when you don't have an answer, or tell your team when you made a mistake, or taking accountability for maybe the process not being perfect, but we can improve it as a team. It's no one's fault. It's a breakdown in the system, and really learning what that means as a business owner, not just saying it, but practicing it has been really, really important. But it's made a team here that I can really count on, and that I know feels comfortable coming to me, so that way we can give the best patient care possible.
Awesome.
Yeah.
Very good. Okay. If people want to learn more about you or your business, where should they go?
Yeah. So if you want to know more about us, make sure you check us out on Facebook. We try to stay really active with social media. You can find us on Instagram. Both of those are going to be Evolve Medical Care. You can also visit our website to learn more about our program. It's www.evolvemedicalcare.com. Again, that's www.evolvemedicalcare.com. We're located here in Pensacola, Florida, but if you're out of state, make sure to send us a message. Sometimes we have state licenses that aren't quite posted on our website, and we'd be happy to help.
Is there anything else, final message or comments that you would like to share with anybody watching?
I think I'd like to tell you guys, make sure that you make time for opportunities like this. As small business owners, sometimes we only make time for those revenue generating activities, and taking time to connect with other business owners maybe that aren't even in your same industry has always been really, really fruitful for me, because I've always learned something. And I think making those connections, you never know when you're going to need to call on somebody again. So I say make time for things that aren't just revenue generating, because the investment is great.
I agree.
Yeah.
You never know. You may have lunch with somebody and have a conversation that could save you 6 months or a year of frustration.
Absolutely.
Right? Or a connection with somebody else.
Yeah.
Like when I started networking, things started changing.
Oh yeah.
Right. So, Kaitlin, I really enjoyed this.
Thank you.
Thank you for your time.
Yeah, it's been great.
Good luck with everything.
Thank you.